So for my Keystone, I analyzed data for a study observing relative advantages and the compatibility of a novel biometric tool in Zambia. We utilized interview transcripts from our research collaborators in Zambia to conduct a qualitative analysis. So for background, the search system is a biometric patient identification tool that is a proposed solution to replace the existing under 5 card system. And the existing system relies on caretakers to maintain a physical card that will contain all of a child's most important health information, including vaccinations. And as we'll see, this card can get easily lost or damaged, and it costs money to replace. So the current search system is a mobile application that utilizes a pattern recognition software to recognize a unique identifier of a photo of an ear. And it also uses a hardware component, which is a 3D printed plastic cylinder that looks like this. So you take the photo on a phone here, and it'll be able to pull up with very high accuracy the patient who's you, and then you take the photo of an ear through the donut. And so that the donut allows for like standardization of lighting and placement of the ear within pictures. So our research objectives were to understand the perceived relative advantage of the search system over the traditional under 5 card system, understand the perceived social cultural compatibility of the new system, as well as the pragmatic compatibility, and finally understand the extent of the physical deterioration of an under 5 card over time. So focus groups were conducted by Zambian researchers with 59 mothers who were recruited from health clinics in both rural and urban settings. Key informant interviews were conducted with head nurses, clinical officers, a district health officer, and an information officer. Zoom in onto our methods. Analysis of the data was grounded in the first 2 of 5 factors of the Rogers theory of innovation, which is relative advantage, how much better the innovation is compared to the product that it replaces. And the second is compatibility, how the innovation is consistent with the values, experiences, and needs of the target population. So here on our little methods graphic, you can see that we, the Boston team, received the transcripts and went through an initial transcript read through so as to establish some general themes. Then we went through and coded the transcripts under those themes, and we came back together, refined the code book, and in order to account for discrepancies in coding amongst researchers, we had a second round of coding, and then we conducted analysis and developed these figures. So if we look here at figure 2A, we have the proportional representation of the relative advantage of the biometric system as compared to the under 5 card system. So the big red circle on the left is the negative comments made about the current system, represented proportionally to the positive comments in the small box with the tiny green circle underneath. So we can see that there's a significant disadvantage that the existing system presents, and the novel biometric system has significantly more positive comments made than negative comments. In general, we saw that the biggest advantage that the biometric system presented was in data management. And if we zoom here onto figure 2B, these are some transcript excerpts that are categorized under the under 5 card system and the biometric system. And overall, you can see that mothers are complaining about difficulty in receiving treatment given not knowing the child's vaccinations that are or their health history. Illiteracy rates also cause mothers to bring the wrong card occasionally, and it easily gets lost or damaged, and this negatively impacts the patient experience due to feelings of shame or feeling like a fool, as one mentioned. There's also a cost burden associated with the under 5 card system because if it's damaged or lost, they have to replace it and pay money for it, and sometimes under 5 cards are not available or in stock at the clinics. So the biometric system therefore provides a solution that is free and wouldn't impose the cost of the burden on the patients, and it'll be easier to reference patient history and subsequently improve continuity of care. So moving into our socio-cultural compatibility, we had 3 prominent themes that emerged within social cultural compatibility, which are partner acceptance, Satanism and religion, and fear or political distrust. So we saw that there were quite a few mothers who said that their husbands would be pretty hesitant or might not let them participate in the novel biometric system. And they would reference like the stubbornness of their husbands or their hesitancy of new systems. But also many respondents mentioned that their husbands would agree because of the diminished costs. And if they were to have it explained and they would understand the purpose and the mechanisms of it, then they would be able to accept the new system. Satanism and religion pose a significant cultural barrier. Zambia is a very Christian nation with 85 to 90% of its population identifying as Christian. And because of the heavily Christian-based political system and education systems, there's a very potent fear of Satanism and the spread of evil among Zambians that underlied a lot of our research. And there are ideas that the biometric tool would be connected to Satanism, or it would be collecting your child's ear data for Satanists. And this would pose a significant barrier to implementation and trust within the biometric system. But also respondents did mention that sufficient explanation would be able to alleviate some of those Satanism related hesitancies. At the time of the interviews at the time the interviews were conducted, which was February 2020, there were several instances of murder by gassing with insecticides and subsequent political distress. So during the interviews, the ritual killings and the political distress that exists amongst populations towards foreigners were mentioned quite a few times. So for some, the timing would be suspicious if they are weary of strangers and questioning it for if it's an opportune time to try to build trust with a new system, because the instances of gassing and the subsequent riots that broke out have led to just a lot of distrust and unrest. So moving into pragmatic compatibility, this would be more of how the system is compatible logistically. So some important comments were made related to sustainability of the system and who would be able to come fix it if there was an issue or if there was a system failure. Furthermore, the connectivity and the electrical power would be a significant technological challenge because there are issues with connectivity to the internet and frequent power outages. In terms of community uptake, there would be some healthcare provider hesitancy, although respondents did mention that it would be able to be eased over with trainings and information. The diffusal and community outreach and the way that we approach community sensitization to the new technology would be important for successful uptake. Finally, we also included some results from a study that was looking at the condition of the under 5 cards over time. And you can see here with the graph that after 6 months, about a third of the cards reach an extremely poor condition and almost half have a moderate degradation over time. Overall, we concluded that the novel biometric system fills an important gap in the Zambian healthcare system, and it provides numerous perceived advantages in both rural and urban settings in Zambia. And what also is significant to note is the relative disadvantage of the current system. So based off of what we found about social cultural barriers and pragmatic implementation challenges, we conclude that the implementation should be localized, context informed, and conducted by trusted members of the community who would know the best approach to diffusing information. And then further opportunities for study include monitoring and evaluating the technology while it is implemented through the indicators that we developed through the study. Thank you.